Two major developments tonight in the battle to fight the coronavirus. One we'll get to in a moment, a new CDC study that lends support for reopening schools for in-person learning. The biggest, though, President Biden announcing a sharp increase in vaccine doses available in the coming months, about 200 million total.
That's 100 million more doses of Pfizer and 100 million more doses of Moderna. 200 million more doses than the federal government had previously secured. Not in hand yet, but ordered. We expect these additional 200 million doses to be delivered this summer.
The president also said states should expect to get more vaccine doses starting next week, about 1.4 million extra doses per week, plus a more reliable forecast about vaccine delivery. More now about how we got here from CNN senior investigative correspondent Drew Griffin.
This mass vaccination center inside Atlanta's Mercedes-Benz Stadium could be vaccinating up to 2,000 people a day, but on Monday it had just 150 appointments.
I am a bit surprised at the lack of busyness here.
Yeah. Well, we're reserving the appointments for how many doses we have available.
There's just not enough vaccine. Fulton County Health Director Dr. Lynn Paxton says her team alone could handle 50,000 doses a week. She's lucky if they get 10,000.
We have to be very judicious in how we schedule our appointments. And the important thing I want everyone to know is that we are in no way hoarding these vaccine doses.
Louisiana's governor decided not to have mass vaccination sites for now. There's just not enough vaccine. In Florida, hospitals have canceled appointments because vaccines didn't show up. In parts of Texas, people lined up for hours.
I've been in line since 5 o'clock this morning.
CNN interviewed more than a dozen health officials from across the country, and the message is largely unanimous. For many states, local health departments, and hospitals, it's not just the lack of vaccine doses causing the chaos. For weeks, there was a lack of information from the federal government.
I think having a federal plan would absolutely stop the kind of Hunger Games approach to every individual state, every individual county, scrambling for their own set of rules.
Without knowing how much vaccine is going to be shipped to them and when, it's nearly impossible to plan. And that means crashing websites, appointments impossible to get, and a vaccine rollout that is looking a heck of a lot like that botched rollout for coronavirus testing.
This sounds almost like a repeat of Where's the Testing when COVID first happened.
It does feel a little too familiar. We're in that exact same position with vaccines right now. We're turning away people that we know are over 65 with heart disease, and we're saying, we're sorry, but we don't have a vaccine for you today.
Dr. Amy Compton Phillips, who helps run 51 hospitals in 7 states, is dealing with another big problem. Worry about everyone getting the required second dose. A clinic in Seattle that was vaccinating more than 2,000 people a day is about to face a massive 90% cut.
So what about all of those people who got dose 1? Now our allocation is cut back by 90%. How are we going to get everybody dose 2?
That, too, is playing out across the U.S. Each state gets first doses and earmarked second doses, which are required for full immunity. Last week, Colorado's governor ordered those second doses be used as first doses immediately.
I sent a letter to all of our partners that administer the vaccine, directing them to use all the Moderna and Pfizer vaccine they have, including the ones that were designated as second doses.
Most other states, like New York, are only using second doses on those who've already had a first shot.
The last thing you want on top of this chaos is people get a first dose and then they come back for their second dose and you say, we ran out.
It could all be solved with more vaccine, a problem the Biden administration announced it will tackle with more than 1 million additional doses per week. It can't happen fast enough.
And Drew Griffin joins us now. Hopefully much more vaccine will be available soon. It sounds like one of the biggest problems is just knowing how much of it is on the way. Is there any plan to help straighten out the supply chain?
Yeah, Anderson, that is one of the things that the Biden administration announced today. They're going to try to tell states 3 weeks in advance what you're going to get 3 weeks from now. And that will hopefully end all this Hunger Games type situation that's going on in these states. And also for the people at home who are trying to get online and get some of those appointments, it will be able to schedule them 3 weeks out instead of having these mad dashes when appointments open up on the websites.
Yeah.
Anderson?
Drew Griffin, appreciate it. Thanks. Perspective now from our Chief Medical Correspondent, Dr. Sanjay Gupta, and Michael Osterholm, Director for Infectious Disease Research and Policy at the University of Minnesota. He also served on President Biden's COVID advisory board during the transition. Sanjay, how was Biden's COVID coordinator able to tell governors today that their vaccine allocations would increase by around 16% starting next week? And why couldn't this have happened last week or even yesterday? I mean, where are the doses coming from?
Right. They seem to be primarily Moderna doses that are coming, that are being released. Maybe some streamlining of production overall as well. It's a little bit hard to figure out exactly how they are accounting for that and how they can be so confident that it's going to be that number. But it sounds like they have at least confidence in the next 3 weeks to be able to release those doses. This does not seem to include, as we were investigating this today, the 6th dose in these vials. You remember that, Anderson, that instead of 5 doses, many of these Pfizer vials contain 6 doses, and if they had these specialized syringes called low dead volume syringes, they could actually get that 6th dose out. But they seem to think that they can get to this 20% increase just with more Moderna doses and streamlining some production.
And Professor Osterholm, with the 200 million more doses the country's purchased, President Biden says 300 million Americans should be able to be fully vaccinated by the end of the summer or early fall. Do you agree with that prediction?
I do. I think the one challenge we have is going to be vaccine hesitancy. We're going to hit a point here in some time in not too distant future where we're going to have more than enough vaccine. The question is, will people take it? And we have a lot of work to do right now to educate the public why these vaccines are so important, why they are safe, why they are effective, and why they could save your life or the life of a loved one. And unless we do that, we could have a substantial number of people come summer that still aren't vaccinated.
Sanjay, researchers today from the CDC published a study that found with the right mitigation strategies, it's possible to reopen schools with minimal COVID transmission. Should schools reopen given this?
I thought this was a very good study. I mean, you know, I will preface by saying, you know, look, I thought in the beginning I was very concerned about opening schools and just the idea that kids would spread germs, especially kids between over the age of 10. But, you know, I think this was an important study with 17 rural Wisconsin schools. They had enough resources to be able to make sure everyone had masks, they could keep physical distance. But I think we have the results of the study. Basically, lower incidence of COVID in the school versus the surrounding community, and significantly so, 37% lower. Just to give you some context, 191 cases of infection were found among students and staff. That was out of about 5,300 people, and only 7 of those 191 actually seem to come from the school itself. So you could start to make the argument that schools, if they have appropriate resources, seem to potentially be safer places than surrounding communities. We've seen that here. We've seen that in other places around the country. I think if schools have resources, you could make the argument they should open.
Professor Osterholm, do you agree?
I do agree. I think the one challenge we have before us, though, is with this B117, the UK variant takes off, we have seen in Europe that, in fact, they had to close schools in the UK, Ireland, the Netherlands, Denmark, to try to bring the transmission down. But otherwise, what we have right now in this country, I think this really does give us reason to look at opening schools and feeling that we can do it safely.
Did they have to do that because the British variant is more easily passed than the other?
You know, at this point, we just don't know. And if you look at what happened in England, for example, they had shut down much of England, but not schools. And the case numbers kept going up. They did shut down schools. And while we can't say for certain it was cause and effect, meaning exactly due to schools closing, that's only then did the numbers start to flatten off. So I think we have a lot to learn from that yet, and we're going to need to apply that possibly here should this variant take off here in the United States in the next 6 to 12 weeks.